Good morning. Welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana, and Chief Medical Officer of Good Samaritan Physician Network. With me, as always, Adam Thacker, who's our Chief Operating Officer and pharmacist, to answer all the difficult questions with regards to medicines and vaccines. We're going to give you our weekly update on status of COVID-19 in our community, a little bit about where we've been, where we're going, and some of the important dates that are coming up over the course of the next month or so. To start off with, our general statistics, over 3,600 cases since we began, but the important numbers that we talk about are number of active members in the community that are carrying the infection, which is around 10, which is very low. Looking at the 7-day positivity rate, about 1.5% for everybody and about 3.7% for those unique individuals. Those numbers remain low. They've continued to be low when we look at the active number of cases in the community, hovering in the single digits for the last several weeks, which is very important because when we talk about community transmission, those low active number of cases, those low percentages, that's really what tells us that there's not going to be another rise immediately. So when we look at those things, everybody wonders when the third or fourth or fifth or 10th wave is going to happen. As long as we see those numbers staying low and there are a low number of cases, that's encouraging. And then we also see that there have been very few hospital admissions as well.
Right. Really, throughout the month of March, as we saw that continued decline, the month of March has been very flat. So we really haven't seen a pickup, as you mentioned, single-digit cases. That's carried over on the acuity side to the inpatient hospitalizations, as we have had, very few, less than 5 patients in the hospital at any given time in the month of March that were in the hospital for COVID. And that's a really good trend, and obviously we tie that to a successful vaccination program. Just looking at the data, 70% of our vaccines have went to 60 and older population here in Knox County, and as we know, since inception of COVID a year ago, that older population, more risk for hospitalization, more risk for ultimately death and a bad outcome. And so we've really seen folks in the older populations come and get vaccinated, and then you combine that with the number of individuals who have had COVID and recovered, we start to really see a high percentage, 50+%, when you combine the two, natural immunity and vaccinations, that have some type of immune response and protectivity, and that's leading to these lower numbers, and that's what's also leading across the state to the exciting news that we heard last week.
So a lot of people are asking, well, when do we reach herd immunity? Like there's a magic number that we have in mind, but really what Adam is saying is probably the most important thing, which is a higher percentage of our older population that's above 50, above 60, above 65, and 70 has been vaccinated. So regardless of the fact that we don't have 85, 90% herd immunity, what we do have is the higher risk population has a much higher percentage of being vaccinated. And when we look at how the vaccine system was rolled out, that was the focus, really looking at our highest risk population, getting them vaccinated. And really what we've seen is that has progressed and rolled down to announcements of opening here in Indiana for nearly all the population. So tell us a little bit about what the numbers are and the dates behind those, because that's happened very quickly over the course of the past 2 weeks.
Right. And we somewhat anticipated that this was coming towards the end of March. And when you saw that the governor's Wednesday 2:30 week-by-week update was changed to Tuesday evening at the State House, you knew that there was going to be some news related to this. So the big dates that came out of that, talking about vaccination, on March 31st, vaccine opens up to all Hoosiers that are 16 years of age and older. So why 16? We have one vaccine that is approved for age 16 and older, and then we have 2 vaccines that are now FDA approved and they are 18 and over. So that is why the age 16 and over for all Hoosiers that are eligible. And really expect to see from March 31st a big uptake in vaccine. Even if the percentages in those populations aren't really high, it's a very big population of Hoosiers. So that will be great. That continues to move us forward. And then the other big date that I think was probably the most anticipated was what's going to happen with masking. And on April 6th, the statewide mask mandate as part of the executive order becomes a mask advisory. Now, we've talked about this internally, and before there are burning parties of all the masks that you own and celebration of throwing them away, hospitals across the state of Indiana, vaccine sites across the state of Indiana, all schools K through 12, all state buildings across the state will still require masking. And then on top of that, there have been some counties that have already came out and said, countywide, we're sticking with the mask mandate. That latitude was given by the governor to say these are local decisions that will be made. And then even within the county, businesses may stick to a mask mandate. I think what is a critical communication point this morning and for everybody to understand is on April 6th and forward, if a business requires masking, whether they're a national organization that the national business headquarters has decided that, which will happen, there's already been some come out and say that that will be the case, or whether it's a local business that has said, hey, due to health risk, health concerns, want to stick with the masking mandate, everybody needs to respect that and follow those guidelines, because that is going to be supported to the letter by community authorities, because the businesses have that ability, and that is their choice in doing that. And so we all just have to be aware of that. So don't throw the mask away. You're going to be able to take it in and out of your pocket, and certainly outdoors as the weather is getting nicer. We're not going to have the funny face burn, sunburns around the mask shape that you see online, hopefully, as we're able to move away from those. But it's really exciting that we're able to move in this direction, but I think it's our responsibility to say that we still have to move forward with a little bit of caution. We may see cases increase. For the naysayers on the side of moving in this direction as to this is too soon, what about the concern of the 24th surge, is we are a year into this, and the collaborative sharing of knowledge over the last year in the health community has been amazing, unmatched. Any competitive lines have really been broken down, and just sharing of how to respond. So if there is a resurgence of some cases, we'll be able to respond very quickly, both from a healthcare standpoint and from a health policy standpoint. I'm certainly not going to sit here and say that there won't be any type of resurgence, and we won't have to look at, okay, what are we doing with masking and public health measures, because one thing that we know is that they work. Now, ideally, we don't have to go back in that direction, but we are prepared that we can ebb and flow with restrictions and relaxing.
And as Adam referred to earlier, one of the there have been multi-factorial things that have contributed to things getting better. Not the least of which has been the start of the vaccine program back in December, monoclonal antibody infusion that we've been using since that time. We have transitioned through our most infectious viral time of year as we are getting into March and April now. And so there are several things as we go through the months that will lead up to our next viral season coming up in the fall that will continue to happen. Vaccine program continues to happen. We will learn more from surrounding counties and surrounding states and around the world as to how things go, variable based on the season. And so as we do this, we will keep you informed and let people know how things are going. And the mask advisory really allows people to respond appropriately based on what their community needs are. So what's good for Indianapolis or what's good for Chicago, what's good for Champaign, Illinois may be different here locally, but it allows us to respond and make those changes locally in an appropriate manner based on what we see as far as numbers are concerned. The vaccine changes are big, and the thing that Adam referred to as far as dropping down to the population in the 16, 17, 18-year-old range, we have started a collaboration with the schools as we have been going throughout the past year. We've been very fortunate to work with the schools locally and have kept kids in session in school, have had very low numbers in our schools, have even continued sporting events, which unfortunately in some of our surrounding states have not been able to do. And so we've continued that program to work with them, and we'll be offering a system where we can get those vaccines out to interested kids in the 16, 17, 18-year-old range. Many people would ask, well, why do my kids need to be vaccinated? Because we have seen very low problems in terms of bad outcomes and severe illness in that population, but that continues to be an opportunity to reduce spread of the disease. And then honestly, one of the biggest driving factors for a lot of kids that are in that age range is being able to stay in school and continue to participate in sports. So if you are fully vaccinated and you have an exposure to someone, you won't be required to quarantine as we previously would have done in this last year. So there's lots of potential reasons. Certainly, we feel the vaccine is safe down to that age range. Why is it that one vaccine is certified down that low and the other ones are not? It's because that's how they chose to run their study. So there's not something magically better about the Pfizer vaccine that makes it okay to go down to 16 versus the Moderna. But whenever you start this process, you have to say, this is our target population, this is who we're going to test it in, and that's how things play out. So we can probably anticipate that there will be more rollouts of that and more openings, but as far as right now, that's how that's going to work. And you might explain a little bit as to what our plans are rolling out to the schools.
Yeah, and just commenting on the younger age, Pfizer, Moderna, and Johnson & Johnson, all three have ongoing clinical studies that are ages 12 to 15 or 12 to 17 in those other vaccines. So they are looking at that next population of adolescents and moving forward. And the question I've gotten a few times is, does that mean it will be required before next school year? There's too many determinants to figure out on that. For one, it will have to go through the clinical trials and be FDA approved, and then the schools probably at a national level will start to make decisions on what those requirements are and roll that to states. As far as our collaboration with the school, as we mentioned many times throughout the pandemic, from testing, quarantine, return to school, we've had a really strong working collaborative with all of the schools in our county, and have had monthly to even sometimes weekly calls with superintendents and individuals that they brought in. So late last week, we were able to have a call, and the Pfizer vaccine is the vaccine that's approved for that 16 to 18. That vaccine, because of its storage requirements, is a Good Samaritan. So in talking with the superintendents, we are over these next few weeks going to be setting up a process where students of that age, 16 to 18, or potentially 19, if they're senior 19-year-old, will be surveyed by the schools, ask about their interest in getting vaccinated. This is obviously a voluntary program, and then we are going to take mobile sites to each of the high schools and be able to vaccinate those students, so they don't have to come to the hospital, have to figure out outside of their school class schedule, their extracurricular activity schedule, what to do. We'll be able to come to them, just as if right now Red Cross and other venues go to the schools and do blood draws. It is a very similar process that we'll be going to the schools and offering that for those students that want to get vaccinated, that have parental consent, go through all of those normal steps. But I think it's really a positive move in our community to be able to take that to the school, make it easy. It's a similar concept that our health department is using with employers, and that we're looking at how to partner with employers to take the vaccine to the site. And again, it's about convenience, making it easy, and just removing that one more barrier of how do I get to the site outside of my regular schedule.
And as we move forward and things continue to open up, our vaccine site here will continue to be open for a while. The health department site will continue to be open, but moving forward, there will really be more of a dispersal as the Johnson & Johnson vaccine becomes more available. We anticipate that as we move along, that will be something that will be like any other vaccine, moves into our physician offices. So the timeline of that really coming up over the next probably 3 months or so we're looking at.
Yeah, really anticipate as we get towards summer that'll start to transition away from. So the vaccine program right now is really a federal program. So all available FDA approved vaccine is owned by the federal government, and then it is distributed to the states, and it is provided, and we collect insurance information and demographics just like any other vaccine, and we bill that for an administrative fee, but the vaccine itself is free. That will start to move into what we would consider a regular supply chain. Health systems will buy the vaccine, and then through primary care offices, through the immunization clinic at the health department, things will start to move back to just where your hepatitis vaccines and your flu vaccine, pneumonia vaccine, everything else goes through. The timeline on that is in the next few months. What we know from a federal level is by May, that vaccine should be offered to all Americans. And so depending on uptake will depend on how fast that moves into the normal processes, but really expect it to be in the summer and then moving forward into that. And certainly mentioned ongoing studies, there are some factors that will impact that, such as we know Pfizer and Moderna, even though that they are 2-shot and they have their storage requirement, they are looking at what the pilot of a 1-shot regimen is and moving in that direction and moving to refrigerated storage versus ultra cold, that a primary care office can't really obtain that type of storage on a regular basis.
And we're very fortunate for a variety of reasons to be in the rural setting that we are, because early in the pandemic we got to learn from the larger centers as to how things were going and what numbers were going to look like and how treatment was going to go. We're also fortunate now because we have a higher percentage of our population vaccinated than when we look at big population centers and urban centers as well. So we would like to thank everybody in the community who has participated in the vaccine program, because really it's important to us when we look at what's best for our community, what's best for our population, that higher percentage, that higher number of people that have higher risk factors and concerns for the disease. Those people have been vaccinated over the course of the past 3 months, and it's exciting to see what percentages have been vaccinated. And then as slots open up in the vaccine clinic, we're able to get more and more people in, more and more people to get vaccinated. So we thank everybody for participating in that. It's been a very successful program, and what we're seeing in terms of the good numbers in our community now is a direct result of that. So thank you all for doing such a good job with that. Now, as we move forward, there's all kinds of things in the news with regards to the different variants and what's becoming the predominant variant and things like that. But I think one of the important factors to realize is throughout all of those things, the virulence, the severity of the complications, the comorbidities, how that all plays into it, even though there are pockets of that around the world and even within the United States that are becoming issues, people aren't as sick with that. I think that's one of the things that we've seen reported.
Yeah, as we've seen some of the variants, you see that uptick in cases, but really from a healthcare standpoint, we want to look at hospitalizations, and so where does that track and trend? Without question, the more cases, positive cases, are going to lead to some hospitalizations. So certainly preventing illness is kind of paramount. But if we're seeing mild to moderate illness, even we've had some cases where folks have been vaccinated, fully vaccinated, and has still tested positive, which we've talked about. You will test positive because it doesn't prevent the virus from entering your body and being detectable. It prevents clinical, moderate, severe illness being hospitalized. And so we've seen that remain low, even where variants may pick up because they're more easily transmitted, and see those number of cases. Hospitalizations have stayed down, and ultimately that is really the leading indicator that we want to look at. What are the hospitalizations? Because we know at that hospitalization point, that is where you're at higher risk for death, and ultimately we want to prevent that.
And certainly we still encourage people, if you develop symptoms, please call the triage line, get into your primary care provider, get tested, because although it's rare, I typically am seeing maybe one case a week or one case every couple of weeks. We still want to make sure that we identify those people, and then more importantly, identify those individuals that have higher risk factors for more severe disease and get them treated. We have ample quantity of the monoclonal antibody infusion that's available, going from administering 12 to 15 of those a day now to one a day or one every couple days. Just tells us how much less active infection there is in the community. But we still want to make sure that people are aware that that is available, and one of the key factors is identifying those people early, their risk factors early, and getting them in to receive that treatment. Because really within the first few days, that's the key time frame as far as getting that administered to avoid more severe disease. One of the other things that we want to encourage people to do is we are coming into the time of year where people generally focus a bit more on health maintenance. It's becoming a little healthier time of year when we talk about preventive medicine, health maintenance, well child visits, sports physicals, those types of things. This is really the time of year where we tell people that we want you to get in, we want you to see your providers. There have also been a whole host of people that have kind of delayed services for the entire last year because of concern of illness. And so again, we want to make sure people understand this is a safe time to receive any type of health care.
Yeah, And we've talked about it throughout the pandemic, but putting off necessary care, it's not going to resolve itself. And COVID or not COVID related, if you need medical attention, whether it is preventative care, annual wellness, or whether it is a nagging ailment that you just think I can put it off another week, it's in all likelihood only going to get worse, and then the care path is only going to be a longer recovery, potentially a surgery that maybe could have been avoided. I mean, there's a whole host of scenarios, but certainly our processes here, from infection prevention to our staff awareness, our visitor policies that we have maintained, a balance of allowing visitors but restricting unnecessary visitors, except in certain situations, has been all about protecting our patients, protecting those that come into our building. And we have a Safe in Our Care program that you can go on our website and see all of the actions that we take to make sure that whether you're coming to a medical practice like Dr. Stine's, or whether you're coming to surgery, or have to be admitted in the inpatient or the emergency department, all of those areas are really scrutinized for how do we keep you as safe as possible, and would just strongly encourage seeking out care that you have put off, or care that you're considering putting off. I know that it's a time where there's still hesitancy in coming to the hospital if I don't have to, but certainly seeking care. And then we have really ramped up and continue to be really developing our virtual care. So there are certainly avenues of care that are virtual where you can receive care from your couch. It's not appropriate for every patient by any means, but where it is, we're able to do that. Again, we have resources online to help to navigate how to do that. We have our COVID support line that you can call and help to get direction on kind of where do I go, how do I seek care. So all kinds of resources to make sure that we're getting care timely.
Yeah, certainly, I see patients every day that for the past year have put off their gallbladder removal, put off their hip replacement, their back injection, their knee injection. They've struggled with getting their diabetes, their high blood pressure under control. And it's important to realize that putting that off a little while while we're in the midst of the pandemic was likely appropriate. But as Adam said, it's important to get back and get those issues under control, because a lot of those problems that we saw put off generated issues like heart attacks and strokes and other bad problems during the pandemic. So we want to make sure that people get tied back into their healthcare providers. The other thing that has obviously been a big burden for everyone is the mental health ramifications of the last year. There's not a single one of us that hasn't been through the stress and anxiety and depression associated with what everybody has dealt with in the past year. So we want to make sure that people understand also, many times as we come into spring, a lot of those symptoms will start to improve. We're coming out of the fog of the pandemic. We're coming into a better time of year from the weather standpoint. But if you have symptoms that persist and you are fearful or overly anxious or having persisting depression symptoms, please get in to see your primary care providers. This is something that we don't want people to suffer in silence with and continue to kind of muddle through over the course of the next several months, because things should be getting better, and we want to make sure that people are re-engaging and not being overly concerned about that. Any other big issues before we move to the phones?
I don't believe so.
Tiffany?
I have no questions.
No questions.
No questions at all, so you did a good job.
All right. We will be looking over the course of the next several months as to how this particular program evolves. We're not planning on turning it into any type of baking or cooking program as far as I know, but we'll keep everybody informed as to how that's going to evolve, and we'll see you all next time. Oh, hang on, we got one sneaking in under the wire.
Are there any updates on pregnant and breastfeeding mothers and vaccines?
So the latest statement from ACOG, which is the national body that gives recommendations on safety, efficacy of various treatments in those populations, breastfeeding women and pregnant women, support getting vaccinated. So basically that it has been their statement that they support having a conversation with your physician, but getting vaccinated. Every pregnant mother or breastfeeding mother has to assess risk benefit. From a healthcare standpoint, that's the world we live in. Is always risk benefit because everything has a equal side to the risk and the benefit. But ACOG does support it. We certainly support that pregnant or breastfeeding women as your eligibility, which as of 3/31, there is probably going to be a very large population of childbearing women that will become eligible. We would support getting vaccinated.
No, that's it.
All right. Thank you all for being with us this week, and we will see you next time.